I tell women who are older, it's not about this training block right here, or, in 6 weeks, you're going to be able to deadlift X amount of kilos. It's about what you want to do when you're 80. You want to be independent. You want to be walking. You don't want joint replacement. You don't want to be living in a frailty. So resistance training is the bedrock there.
The slightly older generation, maybe women in their 30s and 40s, could you outline some of the key advantage and benefits of that demographic weightlifting, especially around perimenopause? I'm thinking increased muscle mass, greater bone density. What are the other real upsides for women who might be watching this, who have never lifted a weight, but are at that age thinking, okay, I should really be doing this?
Yeah, so it's beyond just the, getting lean mass and maintaining it and trying to change body composition to a positive scope for perimenopause. When we look at it from like longevity and a brain factor, we know that if you're doing aerobic exercise, you can increase BDNF and get better brain tissue volume. But when we're looking at resistance training, it's more the neuro pathways. So if we're looking at attenuating Parkinson's, attenuating Alzheimer's, dementia, we need the resistance training because it's creating new neural pathways. If you're looking at how your central nervous system has to respond to the load, how it has to learn the pathway for muscle recruitment, it's all in the benefit of better neural pathway. And then we get better proprioception, better space and time. And so when you get older, if you happen to step off a curb wrong, your falls risk has decreased significantly. And if you do fall, you have the strength from lifting as well as the bone density not to break a hip. So it's more, I tell women who are older, it's not about this training block right here, or, in 6 weeks, you're going to be able to deadlift X amount of kilos. It's about what you want to do when you're 80. You want to be independent. You want to be walking. You don't want joint replacement. You don't want to be living in a frailty. So resistance training is the bedrock there.
You've put plyometric training front and center of your menopausal women training program, which I find fascinating. I guess the extension of the power training. Why is plyometric training so important and so crucial in your mind? And on the flip side, again, with the resistance training, is it an even greater stretch trying to get women to embrace plyometric training? Because that seems like an even further, more advanced step from kind of the traditional cardio machines that a lot of them will be more familiar with.
Yeah, so when we look at plyometrics, again, it's the eye of maintaining muscle integrity, because the first thing that goes beyond strength is also power. So we're seeing a decrease in muscle quality. We're seeing a decrease in the absolute amount of muscle fibers. So we look at plyometric, it's all about that explosive rebound, really fast accessibility of muscle fiber. So it's the neural connections, central nervous system neural connections, but it's also creating a stress where the body's like, I need to hold on to this tissue and I need to make sure that's very viable. So when we talk about muscular strength and power, plyometrics is great for that. But then the other thing is with plyometrics, we get a really acute metabolic change. So it's such a strong stress to the body that it instigates better blood glucose control and better blood glucose uptake without the reliance so much on insulin. Because as women get older, especially late perimenopause, early postmenopause, there's more insulin resistance. So this is why it's really critical. And I'll tell people, look, you don't have to be doing a box jump up 30 inches, right? We can do low depth box jumps. We can do counter movement jumps. You can do battle ropes if you don't want to jump. It's explaining about the power-based aspect of plyometrics, because it's not about the high jumps that people think about with plyometrics. And there's massive pushback, because one of the first things I get is, I can't jump. My knees and hips won't let me. It's like, okay, well, we need to strengthen everything around the joints, because we know there's greater inflammation and an increase in osteoarthritis around perimenopause. But if we start low and work our way up, just the same with heavy lifting, you're going to be able to do the plyometrics within the confines of your own movement category.
Is it a more difficult sell to get women to buy into this because maybe the benefits aren't immediate? If you have never lifted weights or never deadlifted, for instance, you can probably see with the right coaching a very quick improvement in the weight you're lifting, which can be reinforcing and convince people that it's the right track. With plyometric training, is that a different battle altogether? Because you've probably got to take a few steps backwards in order to improve joint integrity or all the other things you mentioned before you can progress. Is this another obstacle?
It can be, yeah. But I always put it in I guess, the training terminology of undulating periodization, knowing that there's going to be a fallback and then a step forward. So the fallback usually occurs in more of a deload. So it is incorporated, and we're like, okay, here's the training step. You start at the bottom when we work our way up, and then we take a step back. And this is normal adaptation. And when people understand that, they're like, oh, okay, I can see now this is where I'm going to fall back. I'm not going to get frustrated. But it's all part of the long game of where I want to be in 3 months, 6 months, 12 months, et cetera, down the track. And it's always a stepwise progression. And when someone understands that, then they're like, oh, I get it. Yep, I can take that step back.
In terms of training hierarchy, women are busy, right? Especially if they're age, if they've got young children in their 30s and their 40s. How should somebody prioritize their training? Because they probably want to incorporate some strength training, some plyometrics, some hits, and slow, steady state intensity work. What is the big rocks here in terms of where they should be focusing their priority if they do only have limited training time?
Yeah, so it depends really on where they are in their life journey. If we're looking at early 30s, early to mid 30s, and they're not having any kind of overt symptomology of being in perimenopause, so they're still responding well to training and that kind of stuff. Of course, resistance training is the bedrock of it, but it can be mixed up. So it can be a box fit type class where you're having some lifting and some metabolic conditioning all within the 45 minutes. Or you can look at it as having 2 weeks of intensity and resistance training, so short, sharp stuff, and then 1 week of we're going to do more steady state, zone 1, zone 2 recovery mobility stuff. And you can mix it up a bit. When we start getting into perimenopause specifically, this is where we really need to have that focus on resistance training complemented with sprint interval training. So a session could be in and out of the gym or your garage in 35 to 40 minutes. So this is where you're looking at doing a couple of compound movements, and we're following the 3 to 5 rep scheme. And then you finish it up with maybe 5 30-second blasts as hard as you can with a minute recovery. So you're getting that little bit of metabolic high intensity work at the end of a heavy lift. So you're really kind of confusing central nervous system from recruiting heavy power to all of a sudden the explosiveness. So from a metabolic and a central nervous system, they complement each other. So it can be short and sharp 3 times a week. And so that fits in a lot with time management. And then other people are like, well, I don't have 35 to 40 minutes. What do I do? It's like, okay, well, take 20-minute block here and focus just on the heavy lifting. And I mean, I say that as I'm sitting here in my jeans and t-shirt, because I did that before dinner. My daughter was playing soccer. I had 20 minutes. I missed getting to the gym. So I did my heavy bench and push press in the garage in my normal clothes. I'm like, oh, 20 minutes. So there's ways of fitting it in, right? And then you can do your 30-second blasts that might take 15 minutes or less later on in the day.